Afternoon and good morning. This is the 2057th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Anita. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again, and you can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. We have so far uploaded more than 3,650 videos. So those who missed the session can watch it again by subscribing Ifph Homeopathy at YouTube. There is no payment for that. So that's all about our Ifph. And let me come to today's guest. As you all know, today our guest is Dr. Anita Chawla. She has completed MD in homeopathy and is the first MD holder from Nashik, Maharashtra. And she's a consultant physician, counselor, study skill trainer, and a study motivator. She has taken several sessions in our forum earlier, and she is running a clinic named Abhinav Clinic, Chindaman Park, Gangnapur Road, Nashik, Maharashtra. She is a winner of many awards. That is, very recently, she got the award Bharat Homeopathy Puraskar on March 26 and awarded as the second prize in short paper oral presentation of the sixth Homeopathy Vignan Sonarian organized by GHF in 2024. And she is awarded a Beacon Foundation Quiz Competition Award held in 2015. Award Beacon Foundation Quiz Competition Award in 2018. Also, she has published a book on history of medicine and homeopathy. She has more than 25 years of clinical experience and including 2 years in heart hospital. And today, Doctor will be talking about role of homeopathic medicine in dengue fever. As you all know, dengue is one of the area where homeopathic doctors can do wonders, because we have seen that several cases whenever the platelets count comes down, the patient will be in a very troublesome condition, and in those conditions, homeopathy can save life by in a significant way or a magnificent comeback to the patient's life. So this is what all about today's presentation. We proudly welcome Dr. Anita. Yes, doctor, you can begin the session.
Yes, sir.
Please open your video.
Yes, sir. Yeah.
Yes, please adjust your camera a little more so that you just watch on the screen so that you get yes, that is quite clear. Fine, fine. Now you can share your screen also. Yes.
Am I audible, sir?
Yeah, yes, you are audible and visible, and your PPT also is coming.
PPT.
Yes, yes. It's open, and now you can go to full screen.
Okay.
Yes.
Yes,
everything
sir.
Fine. Everything fine. You can go ahead.
Okay. Thank you, sir. Okay. Good morning or good evening all. I am Dr. Anita Chawla from Nashik. I am going to present on role of homeopathic medicine in dengue fever. Little bit about dengue virus and dengue fever. Dengue virus is a major health concern throughout the world, affecting up to 390 million people all over the world. DNA virus is single-stranded RNA virus belonging to the genus Flavivirus of the family flaviviridae and is spread primarily by mosquito to humans by the bite of domestic mosquito Aedes aegypti. Sign and symptoms of dengue fever as per WHO guideline. Patient should have high-grade fever around 104°F with the two following complaints. First one is headache, retroorbital pain, myalgia, arthralgia, bone pain, rash. Rash appears usually few days after onset of fever. Hemorrhagic manifestation, no evidence of plasma leakage. From these, two symptoms should be present along with high-grade fever. This is WHO guidelines. Clinical laboratory finding, leukopenia, WBC count should be less than 5,000, and this is a early diagnostic symptom of dengue fever with positive prediction value of 70 to 80%. Usually WBC count remains normal at the onset of fever. Later on, leukopenia develops with decreasing neutrophils and lasts throughout the febrile. Thrombocytopenia, platelet count should be less than 150,000, and mostly platelet counts remain normal in dengue fever. If there is mild thrombocytopenia, platelets count should be 1 lakh to 150,000. About half of the all dengue fever patients have platelets count below 1 lakh. In severe thrombocytopenia, WBC count should be less than 50,000. There should be rising hematocrit from 15 to 20. Course. This dengue fever is divided into three phases. First phase is a febrile phase, second one is critical phase, and third one is recovery phase. In critical phase, there will be no temperature, but the patient develops rashes, and WBC count mostly decreases, and platelet counts also decreases. Probable diagnosis of dengue fever along with high-grade fever following two complaints should be present. Headache, retroorbital pain, myalgia, arthralgia, bone pain, rash, hemorrhagic manifestation, WBC count should be less than 5,000, and thrombocytopenia, here the platelets count should be less than 150,000, and there should be rising hematocrit value from 5 to 20%. Differential diagnosis, mostly chikungunya virus is confused with dengue virus. Second diagnosis, measles. Third one is rubella, influenza, typhoid, and malaria. Clinical management of dengue fever. General management, patient needs to take adequate bed rest. Patient should take adequate intake of fluids in the form of milk, fruit juice, ORS, barley, or rice water. Temperature should be less than 39 degrees Celsius. Advise patient for tapping, sponging of forehead, armpit, and extremities. Warning sign. If there is no clinical improvement or condition of patient is worsening. Second one is patient is having persistent vomiting or not drinking anything. Patient might be having severe abdominal pain. Patient is lethargic, restless, sudden behavioral changes, bleeding in the form of epistaxis, black stool, hematemesis, excessive menstrual bleeding, or dark color urine or hematuria. If any bleeding point is processed from this list, so it is warning sign. If patient is having giddiness, patient's hands and feet are cold, clammy, pale. If there is no urine output or less output for 4 to 6 hours, treatment in allopathy. There is no specific cure, symptomatic treatment will be there. Supportive care in case of mild cases, rest, plenty of fluids, paracetamol if fever is high or there is body ache or joint pain. Avoid NSAID. Do not take aspirin, ibuprofen, naproxen to avoid bleeding. In severe dengue, patient should be hospitalized and IV fluid should be given. Plasma or platelet transfusion should be given if necessary. Patient should be kept on close monitoring. Complications. Severe dengue fever can cause internal bleeding and organ damage. Blood pressure can drop to dangerous level or causing shock. In some cases, dengue fever can lead to death. If patient is pregnant, there is chances of spreading a virus to the baby during childbirth. There will be preterm birth, high weight, low birth weight, fetal distress. Prevention. The best way to reduce risk of dengue fever is to protect from mosquito bite. First, use insect repellent to keep away Aedes mosquito. Second one is wearing protective clothing. For example, wearing long sleeve shirt, long pants, socks and shoes, especially at night. Reduce mosquito habitat by removing standing water in the for example buckets, barrels, bars, or old tires that may hold rainwater, and fill those spots where wet water can pool. Keep mosquito outside of your home by repairing holes in the screen and keeping windows and doors closed. Use mosquito netting at night in area where dengue is common. Pregnant women should not travel where dengue is common. Before traveling to your destination, please check whether there is any outbreak of dengue fever or any infectious disease. Now I am going to present two cases. First case is double fever. Patient had malaria and dengue fever together. Mrs. SK, age 49, came along with her daughter on 29 September 2015. She had following complaints. She had high-grade fever with mild chills since 2 days. Onset was very sudden and history of drenched in rain, and she was wet for 2 hours. She also had severe headache for 2 days. It also started suddenly. She had throbbing pain, which used to increase in the evening. She had pain behind eyes since 2 days. This pain was also throbbing in nature. She had generalized weakness for 2 days. She had body ache. Appetite was decreased since 2 days. Once she was vomited after eating. On examination, pulse rate was 110 per minute. Temperature was 103.6 degree Fahrenheit. Tongue was slightly white and dry plus. She was given Rockstar as she was drenched in rain and was wait for 2 hours. This Rockstar was given every 2 hourly. Advised to take ORS. Follow-up on 30 September 2015. Chills were increased. In the morning, temperature was 102 degree Fahrenheit. From 2 p.m. onwards, fever started increasing. At 6 p.m., temperature was 103.8 degree Fahrenheit. Other complaints were as it is. For example, she had severe headache as it is, severe pain behind eyes as it is, generalized weakness, body aches, and appetite was decreased more. On examine, her face was flushed and dark red. Pulse rate was 112 per minute. Her tongue was light white and dry. Treatment case was reshuffled as she did not improve at all, and advised to take ORS and also advised investigation. After reshuffling case, in the past history, she had right-sided kidney stone in 2008. In personal history, only significant points are mentioned. She had desire for non-veg. Patient was thirsty. Thermally, she was hot. Menses were late. She used to get menses every 5 to 6 months for 2-3 days. Menses were scanty, dark red, sticky in nature. Mental status, she was lazy, short-tempered, very emotional, weeps easily. Doesn't like if someone says about her family, father was alcoholic, did not get love, affection, appreciation from parents. Mother was very strict. She desires company. This was CBC report, and her WBC count was dropped to 3,800, and platelet was 1.93. Here, dengue test, NS1 antigen and IgG antigen was positive. IgM antibodies was negative. MP test was positive. Plasmodium vivax was detected in MP slide. Close coming group of remedy. There were 4 remedies. Magnesium carb, lycopodium, natramur, anti-crude. Finally, the magnesium carb was selected as patient was emotional, easily weeping, short temper, craving for parental love and care, doesn't like if someone says about her family. She desires company, likes non-veg, menses were late, menses were scanty, dark red, menses were sticky, headache was throbbing in nature, even she had throbbing pain behind eyes, fever is to increase in the evening. Natramur is also close coming remedy. In natramur patient is lazy patient, short tempered, emotional, weepy, craves parental love and care. Natramur patient likes to be here, but patient desire company. Natramur patient is lean, thin, and Natramur patient has oily face, but this patient is not lean and thin, and there is no oily face. Thermally patient is hot. Natramur patient gets throbbing headache, menses late, but not late like magnesium carb and nux mosquita. Menses scanty and dark red, menses sticky, but not like McCarb. Lycopodium patient is short-tempered, emotional, easily weeping. Lycopodium patient is hot, right-sided kidney stone. Antim-crude patient is short-tempered, emotional, easily weeping, craving for parental love and care. Menses were irregular, but not like McCarb. Tendency to form calculus. Antim-crude patient is thrustless, but this patient is thirsty. Antim-crude patient has white coated tongue, but this patient doesn't have white coated tongue. And patient is not that much fat like antim-crude. So finally, magnesium carb was given 3 times in a day. Follow up and analysis. 1st October 2015, in morning fever was 100.4 degree Fahrenheit. She didn't have chills. Again, fever started increasing at 2 p.m. At 8 p.m., temperature was 103.2 degree Fahrenheit. Pulse rate was 110 per minute. Tongue was slightly white and dry. Headache slightly reduced. Pain behind eyes slightly reduced. Appetite improved. General weakness was as it is. Even body ache was as it is. Magnesium carb 33 times again given to increase action of the medicine. Advised to take ORS. 2nd October 15, in morning fever was 99.6 degree Fahrenheit. No chills. Fever again started increasing at 2 p.m. At 8 p.m., temperature was 101.8 degree Fahrenheit. Pulse rate was 106. Tongue was slightly white and dry plus. Headache considerably reduced. Pain behind eyes considerably reduced. Appetite improved. Body improved. In dengue fever, mostly temperature it increases twice in a day. 2 times it increases, mostly in the morning and evening. This is a common feature in dengue fever. General weakness was as it is. Treatment Saclec was given as patient was improving and advised to continue ORS. Again, CBC was done to see HbN and platelet count to rule out hemorrhagic fever, dengue fever. Here, WBC count dropped to 3,100. This is common clinical feature of dengue fever. Mostly WBC count falls 3 to 4 days after the onset of the fever. Platelet count was 1.51. 3rd October in the morning, temperature was 99.2 degree Fahrenheit. No change. Fever started increasing at 3 p.m. At 8 p.m., temperature was 101.4 degree Fahrenheit. Pulse rate was 100. Tongue slightly white. Headache reduced considerably. She had mild pain behind eyes. Appetite improved. Body ache reduced. But general weakness was as it is. Seclec was given as she is improving. 5th October 15 in morning, temperature was 99. No change. Fever started increasing after 3 p.m. Temperature at 7 was 101.4 degree Fahrenheit. Pulse rate 102 per minute. Tongue was slightly white, dry, headache reduced considerably. She had mild pain behind eyes, appetite improved, body ache reduced. General weakness was as it is. As there is no improvement seen further, so MECCAB 30 was given and advised to take ORS. In 5th October 15 in morning, fever was 99, no change, but fever started increasing after 6 p.m. Earlier, it used to increase at 2 p.m. Now, on 5th October, fever started increasing at 6 p.m. and temperature at 8 p.m. was 101 degree Fahrenheit. Pulse rate was 103 per minute. Tongue slightly white, dry, mild headache, mild pain behind eyes, appetite improved, body ache reduced. General weakness it is. Seclec was given as she was improving continuously. Again, WBC done to see HB and platelet counts. Here, WBC count raised to 6,600. Even platelet count was reduced to, here WBC count increased to 6,600. When platelet count was raised to 1.82 lakh. 6 October 2015, no fever in the morning, no chest, but fever started increasing at 6 p.m. At 8 p.m., temperature was 101 degree Fahrenheit. Pulse rate was 99 per minute. Tongue was slightly white and dry. Mild headache and pain behind eyes. Appetite improved considerably. Body ache was reduced considerably. Even generalized weakness was reduced. Seclec was given as she is improving. 7 October 2015, no fever and chills, but temperature started increasing at 6 p.m. At 7 p.m., temperature was 100.8 degree Fahrenheit. Pulse rate was 99 per minute. Tongue was slightly white. There was mild headache and pain behind eyes. Appetite improved considerably. Mild body ache, generalized weakness reduced. Seclec was given as she was improving continuously. All investigations were done. WBC count raised to 7,800. Even platelets count raised to 3.08 lakhs. Normal platelet count. Again, MP test was done. It was negative this time. Dengue antibody test, NS antigen and IgG antibody were negative. IgM antibody was positive. 8 October 2015, no fever in the morning. At 8:30 p.m., temperature was 99.2 degree Fahrenheit. No headache, no pain behind eyes. Appetite improved considerably, no body ache, and general weakness was reduced. Seclec was given. 9 October 2015, patient's appetite became normal. Mild general weakness, and other complaints were there were no other complaints. So Seclec was given 3 times for 7 days. Patient came for follow after 7 days. She did not have any complaints, so stopped treatment. Here again investigations were not done because IgM antibodies remained positive for 90 days. So we didn't do again these tests, and all complaints were reduced. She didn't have any complaints. Learning from the experience of this case, in malaria, dengue fever, constitutional medicine is very important. After giving constitutional medicine, this patient started responding from next day onwards. She did not develop rashes and other complications such as internal bleeding, dropping of BP. Exact minimum remedy required to treat dengue fever, malaria fever, and other acute diseases. Now we will discuss case number 2, dengue fever. Mrs. AB is 47 years, came on 17 October 2018. She had following complaints: high grade fever with chills since 3 days. Fever was insidious in onset. History of exposure to sun, taken food from outside. She didn't say any history of mosquito bite. She had headache since 3 days. Insidious onset. Headache was throbbing in nature, used to increase in the evening. She had burning sensation all over the head and mostly on the vertex. She had body ache since 3 days. Appetite decreased since 3 days. Vomiting, only occasionally she used to have vomiting after eating. Constipated bowel since 3 days. Stool was dry and hard and offensive. Burning sensation at epigastric region since 3 days. It used to increase after eating. Pain in abdomen since 2-3 days, more on right and left hypochondriac region, aggravates after eating. In past history, she had chicken pox when she was 8 years old. Personal history, only important points are mentioned here. Desires for sweets, oily non-veg, patient is thirsty, micturition offensive, dark red in color. She had profuse and offensive perspiration. Thermally patient is hot. She had burning sensation also, which is to aggravate at night. Mental status, lazy patient, cheerful, talkative, short tempered, cannot tolerate contradiction, company desire, stubborn in nature, impatient in nature. On examination, her face was flushed and dark red. Pulse rate were 99 per minute and temperature was 103.2 degree Fahrenheit. Tongue was white and dry. This is blood report. Here WBC counts were 3100. Close coming group of remedies: sulfur, phosphorus, arsenic, natramur. Final prescription is sulfur, as patient is lazy, talkative, cheerful, short tempered, cannot tolerate contradiction. Company desires, stubborn, impatient, desires sweets, oily things. She had burning sensation on vertex and at epigastric region. Stools dry and hard, burning sensation on soles, aggravate at night. She had offensive discharge. Offensive discharges, thermally patient is hot. Patient was lean and thin. Phosphorus patient is cheerful, company desire, good patient. And phosphorus patient also has burning sensation, desires oily things, aversion for sweets. But here patient desires sweet. Thermally patient is chilly, but my patient was thermally hot. Arsenic album patient, arsenic patient is anxious, sad, tearful, fearful, short tempered, company desire, stubborn, impatient, more marked in natramur, sulfur, desire sweets, non-veg, especially meat, offensive discharges, thermally patient is chilly, but my patient is hot. Natramur patient is lazy, short tempered, consolation, aggravate, impatient in nature, but it is more marked in sulfur. Thermally patient is hot, natramur patient is hot, lean, thin. Now natramur patient has oily face, throbbing headache. Complaint mostly aggravates exposure to sun, stool dark, dry and hard. Treatment: sulfur was given 4 times in a day. Follow up: on 18 October 2018, fever was as it is, chills were slightly reduced, headache was slightly reduced, body ache slightly reduced, appetite improved slightly, burning sensation at epigastric region reduced, pain in abdomen reduced, constipation, bowels were as it is, temperature was 103.4 degree Fahrenheit, pulse rate was 104 per minute, sulfur 33 times in a day was given. Again, CBC was done to see HB and platelet count. Dengue test was done, as earlier WBC count was reduced to drop to 3100. and she was advised to take ORS. Here WBC count dropped to 3000. Even platelet count was reduced to 2.20 lakh. Here MP test was negative, dengue test was positive. Positive IgM, AB and NS1 antigen was positive. On 19 October 2018, fever slightly reduced, chills slightly reduced, headache reduced, body ache slightly reduced, appetite slightly improved, burning sensation at epigastric region slightly reduced, pain in abdomen slightly reduced, constipated bowels were as it is, temperature was 102.6 degree Fahrenheit, sulfur 30 for 3 times was given to increase the action of the medicine, advised to take ORS, again WBC done to CHB and platelet count. Here 19 October, this WBC count again dropped to 2,500. Platelet count was 2.93. Here on 19 October 2018 at 7 p.m. tuberculin 1 m 3 times in a day as intercurrent remedy was given as WBC count was continuously dropping. 20 October 2018, fever reduced, chills reduced, headache reduced considerably, body ache reduced considerably, appetite improved slightly, burning sensation at epigastric region reduced slightly, pain in abdomen reduced slightly, constipated bowels were as it is, temperature was 101.6 degree Fahrenheit, pulse rate was 96, SL was given and advised to take ORS. Again, CBC was done to CHB and platelet counts. Here, WBC count slightly increased 2,600. Earlier, it was 2,500. 21st October 2018, fever reduced considerably, no chills, headache reduced considerably, body ache reduced considerably, appetite improved, burning sensation reduced at epigastric region considerably, pain in abdomen reduced, constipated bowels were as it is, temperature was reduced to 99.6 degree Fahrenheit, pulse rate 90 per minute, SL was continuous and advised ORS. Again, CBC was done to see platelet and HB count, but patient didn't do as on 21st October, it was Sunday. On 21st October, she did not have fever, chills, headache, and body ache. Appetite improved. She didn't have burning sensation at epigastric region, no abdominal pain. Constipated bowels improved, but she started getting itching along with rashes. Temperature was normal, pulse rate 90 per minute, SL was continued, advised to take ORS, again CBC done to see HB and platelet counts. Here WBC count was raised to 3,600. These are the photos of rashes. I think I think you will appreciate this picture. She developed rashes on feet, arms and on face. 31st October 2018, itching was as it is. Other complaints were not there. Sulfur 3 times was given. Advised to take ORS. Again CBC done to CHB and platelet counts. Here WBC count raised to 3,900. On 25th October 2018, itching was reduced. So she was given SL for 3 times or advised ORS. Again CBC done to see HB and platelet count. Here WBC count raised to 4,900. 27 October, so no complaint. So SL was given, advised to take ORS. Again CBC done to see HB and platelet count. Again WBC count was raised to 5,200. 5th October 2018, no complaint. Sulfur 200 given 3 times in a day, advised ORS. Again, after saying CBC and dengue test. So here WBC count was raised to 7,700, platelet count was raised to 3.42 lakhs, but here here IgM antibody was positive, but IgG and NS1 antigen was negative. November 20 November 2018, no complaint. SL was given. Advice ORS, CBC and dengue test again done. And again you will see WBC count raised to 7,300. Platelet count was normal. Little bit reduced, but patient didn't have any complaint. And here you will see negative IgG and IgM antibody and negative NS1 antigen. So here pictures of rashes reduce. These are the photo reduce. This is feedback from patient which is written in Marathi. Learning from this case, dengue fever phases pass from one stage to other stage smoothly without much discomfort. She did not develop any complication as internal bleeding, dropping of BP, etc. Dengue test became negative in month span. Research study shows that dengue antibody test IgM antibodies remain positive for 90 days, but in our case, IgM antibodies became negative in 1 month of span. And this is all about dengue fever. Thank you so much. Thank you, sir. Thank you, sir.
It's really a very good session, and you really show how important symptoms, whether the disease, whatever be the disease, you will have to think the symptomatology based on
Thank you, sir.
which you will be able to prescribe the right medicine. And after giving the medicine, you just wait for the symptoms to change its order. That's since the eruptions came back, that's a very good indication. That's why you stick on with the sulfur in the second case, and that really give you the result. As you all know that when you get a case, whether it be a chikungunya, smallpox, or chickenpox, or dengue, you may be in a little bit confused in the beginning whether we'll go with this, palliative methods or simply go ahead with the totality of the symptom. Because all these fever acute cases are coming with the acute symptoms, not in chronic disease, just like in chronic disease. So we will have to give relief to the patient first of all. For that, we will require a little more time also. What's your opinion on that, doctor? Because usually people used to come, doctor, I have fever for 2 days, or just last night always I am suffering from these symptoms. And what's your methodology? You just you just wait for the other symptoms to develop, or you just give a palliative medicine as per the first indication, or you just give some medicine in that way.
Sir, whatever symptoms are present, I give medicine on that basis. And a patient is not improving for 2-3 days, then I advise, depending upon how much severity of complaints are there, if patient is not improving, I advise for investigation. If WBC count shows less than 5,000, so in 70%, 70 to 80% cases, it shows dengue fever. So I advise for dengue test. And if patient is other complaint like chills, and then I even advise for MP test also.
So naturally,
And I case full case history in detail, and accordingly I prescribe the medicine.
yes, sir. Usually, we may not be able to recognize whether it's a case of a fever, whether it is going to develop into chickenpox, measles, or this dengue fever. Because So in the beginning, patient may having a little bit of headache or giddiness, or sometimes having temperature, intermittent temperature, little bit of throat pain. Sometimes you take a terror from nostril. So sometimes accurate discharge from watery discharge from eyes, burning sensation like that. And sometimes some patients having little bit of diarrhea in the beginning, or sometimes patient may come to the doctor, I have severe constipation for last 2 days, like that. So, so we will have to find a medicine as per the symptoms given by the patient, and just even without checking. Sometimes if the symptom correspond to gelsemia, I mean, if you give a dose of gelsemia, if the medicine is the right one, then it won't develop into a typical dengue fever. Even before that, the patient may be recovered. That's a homeopathy concept. And if not, the patient showing the signs and symptoms of belladonna or bacteria, if you give a medicine in that way, that itself will heal the case. And sometimes we may not be able to find the other symptoms to develop, and it will become fully flourished case of dengue. If the totality of the symptom was right, that's what I mean. Otherwise, it will fully develop into a typical dengue fever or a chicken pox, or even measles, whatever be the viral disease. So that's the reason why most of us were able to cure the so-called COVID in 3 to 5 days or 5 to 7 days, even developing into fully fledged typical COVID as they claimed. That is the most important point as far as homeopathy is concerned. And I'm inviting Dr. Manoj to join the session. Dr. Manoj want to say something more on. Yeah. Yes. Please unmute, Dr. Please unmute. You are muted, sir.
As you rightly mentioned, that we are able to cut short the duration of disease. Otherwise, it will be only a case of recovery. I have a suggestion to doctor, because you have to revise your policy on repetition. I think you take a long time to repeat. In the case of acute disease, it's mentioned that you have to repeat the medicine frequently, but that wasn't happened. That may be the reason it took a long time. So we have to, what is the idea? The rapid, gentle, permanent. It should be rapid. So it is my humble request you to revise your policy on repetition. Otherwise, the presentation was good. Everything is okay. The very scientifically compiled on. This is my suggestion. Thank you.
Yes, in acute diseases, you can repeat the medicine. That's what Dr. Manoj mentioned. But people used to say that a single medicine and single dose. A single dose does not mean that you have to give a medicine in a single time. But if, for example, if you take a dose of belladonna and put it in water, and you just ask the patient to give every 5 or 10 minutes till the corresponding symptoms of this start recovering, then you can say that dose is the single dose.
Dr. Dhanesh, I don't think so. The dose means the quantity of medicine taken at a time. That is only the meaning of dose. If you repeat the medicine every 2 hours, then it is for 1 day is 12 dose. It means not drop. So that's the definition of the posology of dose. The quantity of medicine taken at a time.
Actually, when after giving the medicine, if it is not working, that means that the medicine may be wrong. But if you repeat the medicine for some more time, then if you get the result, then at that point of time we can call that the dose worked.
Yes, definitely. The remedy reaction indicates that yes, that's no other options. So we have to cut short the duration of disease. If you have to claim that we have cured the case.
That
That's the
means
most
that
important.
the
So
intensity.
duration of disease was reduced. If you read
Yes,
three phases, febrile phase, critical phase, recovery phase, duration was reduced because
But
every
here,
yeah,
what I heard is that swinging is there. One the temperature went down, then again coming down again. Journals are not.
no,
So
this
I
is
think
a common symptom of this is common symptom of dengue fever, which increases twice in a day. In the
whatever maybe whether it is common or uncommon, this is suffering of the patient, isn't it?
yeah.
So we
So,
must
but if you
consider
see
it.
duration of disease was reduced, if you see pathology of dengue fever, every stage has duration. For example, febrile phase, fever remains 7 to 15 days also, and
So
later
while treating homeopathically, things will be a bit different. It
so
not
that was
result.
reduced,
Yes.
sir. Patient, if you see that patient was fully pathological test became normal, it took time, but complaints were reduced in a short period. In 8 to 10 days, patient was better.
Yes.
yes. That's a very good thing. Doctor, if anybody want to talk to Dr. Anita,
And second thing, stored close. It is mentioned that in acute cases, we can repeat doses. We can give 5 minutes also, 5 to 10 minutes, depending upon the situation.
Yes,
So
that is why that is my question. Why you don't repeat the medicine? That's my question.
I repeat it 3 times in a day based on the
In one case, when you gave sulfur, you repeated. Otherwise, you make carb, you didn't repeat. You
the
wait,
three
wait, wait.
times, 3 4 times I had given that also. Most
Yes.
probably I might have forgotten to mention there, but I had repeated 3 4 times.
when you give a medicine, it need not be just like giving 3 times or 4 times, but
It
uh,
is empirical prescription.
yes, we can give it every half an hour or 3 hours.
Half hour also we can give.
And
Yes,
then
sir.
if the patient shows the signs of recovery, we can wait for the
Yes, sir. Yes, sir.
medicine to work in that way. And it does not mean that you will have to give the same medicine at the night also. It doesn't mean.
Uh,
Yeah.
So when patient was showing improvement, I used to give
Yes.
SS, Saclet. Whenever I used to see a patient is not improving, at that time I was giving medicine. And if you see in second case, IgM test, IgM was positive. So again I repeated same sulfur after 1 week.
Yes,
So
Doctor, whether you advise any specific food for your patients? You just give us medicine and allow the patient to give whatever thing you like, eat like that. Any specific advice you used to give to your patients?
I advise nutrition diet. I advise to take a lot of water and dal, rice, fruits, all these things I had advised.
Yes, yes, that's good. High calorie protein diet is always good for patients to recover in and then
Refer.
because that will produce a quick number of platelets that will make that's the reason why I just asked.
I think there is another point, Dr. Danesh. You must remember whether the patient will be able to digest all these things. That's the most important thing.
Yes, yes, yes.
Especially if there is fever, that is quite natural. They don't have enough appetite, or the digestive capacity is low. So we should should have a separate view on as a homeopathic physician on the diet regimen.
Yes, in the first part we can give a simple diet, and when the patient is improving and the patient demands for food, then you can give a certain.
Yes,
That
that's
that's what
yes,
I also meant here. But
yes.
naturally, in the beginning of the fever, patient used to say that, "Oh, doctor, I'm feeling, I don't feel any thirst or appetite. I just want to lay down like that, or even I can't lie down like that." But in those conditions, you can advise the patient to take a little bit of water, even in small quantity, frequently or at times, as per a requirement. Because maintaining the water balance in the body is a very good thing for recovery.
The indigestion often causes increased temperature. That's
Yes,
another problem.
yes. That's the reason why when parents used to give lot of food to children during fever, and all of a sudden this child may start continuous vomiting, and they may come up, oh doctor, the child is started vomiting. But actually, it is a forced. It is because of the forced eating, forced feeding. That may be the reason why such vomiting is coming up. And we may think that it's a sign of disease, but actually it may not be.
So educated patients know they should take food. So though they don't like food, still they take little bit food and other things as they know importance of diet. Probably they may not be eating like usual they eat, but they take food after giving
Yes.
advice.
Yes, Dr. Ambaresh, sir, you want to speak?
Thank you, Daneji. Congratulations, Dr. Anita, madam. Very nice presentation.
Thank you,
And
sir.
case, excellent case presentation. Very good. And select remedy according to symptom and rubrics. Natramur sulfur. So very important. Dengue fever. Angle of treatment. Acute angle. According to symptomological treatment for dengue fever, natramur, phosphorus, gelsemium, bromia, etc. Epitorium for pandemic chronic case, according to rubrics, select mind symptom and past history. Yeah, select the mental rubrics, natramur, phosphorus, gelsemium, etc. So very looking like diet is the very essential dehydration case. Collapse sthiti, carbohydrate is the very good remedy. And dehydration, natramur, supportive use for platelets focus, papaya leaf, papita ka patta, very important, and giloy, goat milk, bakri ka doodh. Dehydration is a very good supporting diet. So platelets. So very thanks, Dr. Anita Chawla, madam. Thank you.
Thank you, sir. Thank you, sir. Thank you, sir, for appreciation.
Yes, Dr. Anita, can you adjust your camera a little more so that you can only half the face is visible? Always you look at the screen so that you can see how you looks in the. Okay, then what is the present situation of homeopathic practice in your place? How many, what kind of practice the doctor is having there in Nasik?
So I see all types of the patient, from malaria, dengue, even I handle cancer patient also. Now day by day, critical cases are also coming. And recently I have treated stroke patient, pneumonia patient.
Dr. Alice, do you want to speak here? Only just 2 minutes remaining. If you want to speak, you can speak, and then you can say what are thanks to this session also.
No, I just joined, sir. I don't know what
Okay.
is. Yeah, no.
Okay, no problem. Okay. Then, if anyone want to talk?
In dengue fever, if you see phase-wise study, 3 phases are the febrile phase, critical phase, recovery phase. If you study these 2 cases, duration of these phases are reduced.
Yes, yes. That's
Duration of even the IgM test remained positive. As per research, IgM test remained positive for 90 days, and in this our case, this test became normal within 1 month.
whether
this
you
is-
people are, yeah, whether you people are getting malaria cases nowadays, because in the north it was, we used to hear that a lot of malaria cases were there. But what is the present situation in your area?
Now also we are getting malaria cases, but frequency is less.
Oh, okay. Yeah. Okay, I now I'm inviting Dr. Ambrose sir to say what are thanks to the session.
Thank you, Anita Chawla,
Thank you.
madam. Very
Thank you, sir.
nice, excellent session.
Thank you, sir. Thank you.
On behalf of IFPH, whole team, very thanks. Khargar Homeopathy. Thank you.
Thank you, sir. Thank you. Thank you. Thank you.
Thank you, Dr. Anita Chawla, Dr. Manoj, Dr. Ambrose sir, and those who attended in English session this evening. Tomorrow we will have a session from Dr. Nikhil Shkunt and Dr. Nirav Kunt, and he is Assistant Professor, Department of Homeopathic Material Medica, Rajkot Homeopathic Medical College, Gujarat, and we'll be talking about efficacy of homeopathic medicine in liver disorders. So hope all of you will join us tomorrow at the same time. Thank you all. Good night.